Olá e muy buenos días a todas y todos. Gracias.
Hello, good morning, everyone. Thank you for joining us on this press briefing today. The microphone is off. The speaker's microphone is off.
Pablo, no hemos comenzado todavía, Pablo. No hemos comenzado todavía, por favor. Cuando yo quite el slate, esa es tu señal. Gracias.
Olá y muy buenos días.
Hello and good morning to all. Thank you for joining us on our press briefing today on COVID-19. I'm Paulo Lira from the Communications Department of PAHO. This session will last between 45 minutes and 1 hour, and we will taking questions to the very end. We have received several questions by email, and you will be able to ask questions live or writing them on your Q&A button. Please always include your name and the media you represent. The session is being broadcast on YouTube and other media so that others can attend. Let me remind you that we have simultaneous interpretation both into English and Spanish. The director of PAHO, Dr. Carissa Etienne, will give us a report of the epidemiological situation in the Americas, and we'll talk about steps that the countries are going to take as a response to COVID-19 pandemic. Dr. Jarbas Barbosa, Dr. Sylvain Aguilera, incident manager of COVID-19 is also with us, as well as Dr. Ciro Ugarte, who is Director of Medical Emergencies of PAHO. Dr. Etienne, over to you.
Thank you and good morning. Let me thank all of you who have joined us for today's briefing. In the last week, we saw more than 2.5 million new cases of COVID-19 in the region of the Americas. That is more than half of all global infections. In the same period, 42,000 people from the Americas have lost their lives to the pandemic. This sustained boom in cases is sobering proof that our region and our world is failing to control this coronavirus. In fact, too many places, public policies are not congruent with the severity of the situation. And many of us have relaxed the control measures that we know work, which have helped us stay healthy and kept hospitals functioning up to now. I am particularly concerned for the next few weeks. Throughout our region, especially in North and South America, many hospitals are operating at or very close to capacity. The reports from Manaus in Brazil illustrate what happens when a health system lacks enough capacity to cope with the speed of new infections. But not just Manaus that is at risk. We've had reports of oxygen being rationed in some locations in the United States of America and in Peru. In fact, ICU occupancy rate stands at 90% in some parts of Peru. Several locations in Brazil and in Ecuador are operating close to their limit. In Mexico City, the majority of beds are occupied by COVID-19 patients, and hospital capacity continues to be challenged in countries of the Southern Cone like Chile, Argentina, and Uruguay. In the Caribbean, the first week of 2021 saw the highest number of cases reported since the beginning of the pandemic. Barbados had a 61% increase in new cases over the past 2 weeks, mostly among the local population. And as cases rise, so does the demand for testing, severely stressing laboratory capacity. The new variants detected in the United Kingdom, South Africa, and Brazil are also concerning, as they may be playing a role in accelerating new infections throughout our region. We are studying the effects of variants on transmission, and our genomic surveillance network of some 21 laboratories is tracking the emergence of variants in the region. Still, these factors highlight the fundamental truth that we must intensify public health interventions to limit exposure to the virus. Social distancing, limiting gatherings, and the consistent use of masks in public settings and frequent hand washing are our absolute best hope for reducing the number of COVID-19 infections right now. We can't stress that sufficiently. These measures remain the best option for places that are seeing cases rise to unprecedented levels and hospitals fill up fast. I urge the leadership of our region to embrace these measures to save lives. This is not the time to let our guard down. Of course, vaccines will also help save lives and eventually halt the pandemic. PAHO is both encouraged and inspired by the speed with which COVID-19 vaccines were developed. But we are also aware that there are not yet enough doses to achieve a visible impact on transmission at this point in the short term. Currently, the doses available for use are very limited and will remain in short supply everywhere as manufacturers race to meet global demand over the next few months. The start of immunizations in some countries is the first step, but we have a long way to go to make this a reality for everyone across the whole region, in poor countries, developing countries alike. No one is safe until all are safe. Our vision is one of equity of access to vaccines, and we are working day and night to make this a reality. PAHO and its partners are at the very center of an effort not only to accelerate access, but to ensure that vaccinations reach everyone who wants to receive them. The goal is to start vaccinations in a comprehensive, safe manner, building sustainable campaigns and immunization programs that can help end the pandemic in every country of our region. The COVAX facility remains the most equitable mechanisms to make vaccines available in all countries in the Americas, regardless of the size of their population or their GDP. So far, COVAX has secured agreements for 2 billion doses of vaccines to be deployed this year. This is unprecedented in scale, but also in the fact that the vaccines will reach all participating countries virtually at the same time. At least 7 countries in the Americas are now vaccinating their populations as part of bilateral agreements. COVAX can complement this effort and indeed help other countries to commence immunizations early. COVAX has agreements with AstraZeneca and the Serum Institute of India for the supply of AstraZeneca and Novavax licensed vaccines as soon as these obtain the emergency use listing approvals from the World Health Organization. As we speak, COVAX is actively negotiating deals with Pfizer, and with further announcements can be expected in the near term. Vaccines are expected to reach countries by March, if not a little earlier. PAHO's revolving fund, which has 4 decades of experience procuring and distributing vaccines, will play a key role in this process, supporting countries along the way. In addition to vaccines, the fund helps member states with the acquisition of syringes, safety boxes, cold chain equipment, and other supplies that allow vaccines to be safely delivered to every corner of our region. So as the delivery times approach, we know that the process will take time due to the demand and supply factors. Countries have only a few weeks to prepare for the vaccine's arrival. Having a comprehensive safe plan in place will greatly facilitate the successful vaccine rollout in any country. All member states participating in the COVAX facility are developing a national vaccine deployment plan that is adapted to their context and their population. These plans cover every step in a vaccine's journey and every stakeholder critical to its success, from the regulatory agencies that issue approvals and monitor safety data over time, to the logistics systems that coordinate delivery of doses and monitor the state of cold chain systems, to the recruiting and training of staff so health personnel throughout the country know how to deliver these vaccines, to the public campaigns to ensure that populations know where and when and why to receive their doses. PAHO is helping countries throughout this planning process. So far, 18 countries have shared the national vaccine deployment plans with PAHO for feedback, and 23 countries have completed the vaccine readiness assessment tool. The vaccine rollouts already underway are also generating important lessons for the region. We are seeing, for instance, the importance of assessing the readiness of each health facility where vaccines will be distributed and administered. And we're also learning just how critical it is to have strong information systems in place to find target populations and to track vaccinated individuals. By hearing these lessons now, countries will be better prepared to introduce the vaccines as soon as the doses are available. For us in PAHO, a successful vaccine introduction must not simply be measured by its timeline, but through the lens of fairness. We must not let vaccination campaigns fracture along the lines of inequity that have mapped the health of our region. Vaccine rollouts should prioritize those at risk, like healthcare workers and those at the front lines of our response, the elderly and those with pre-existing conditions. They also should prioritize disenfranchised populations that often struggle to access the care that they need. We have gained important knowledge and experience in reaching these groups. We do it every year through our seasonal food campaigns that protect over 100 million people every year in the region. Additionally, our region has succeeded with other mass vaccination campaigns that have helped us eliminate smallpox, polio, rubella, and measles. We have the tools that we need to move forward. Our member states have a wealth of experience to build on. Our foundation in immunization is strong and will pave the way for success. There are nearly 1 billion people to immunize in our region. The task is daunting, but not unrealistic. It will take many months of hard work, but here in the Americas, we know where to start and we have the resolve to see this through by working together in solidarity and leaving no one behind. Thank you.
Muchas gracias, Dr. Etienne, por esas palabras inaugurales.
Thank you, Dr. Etienne, for your introductory words. And we have several questions. I am reading the question in English.
Since we're available today, would countries be ready to roll them out?
So let me thank you for this question. I want to sound a note of caution. Countries should not rush vaccination campaigns. Being ready for those campaigns
Dr. Etienne, you are muted.
Yes,
So
again.
I need to start over again.
No, let me press again. Good.
So let me thank you for this question. Obviously, I didn't realize I was muted for so long. So I was saying that I want to sound a note of caution to countries that they don't rush the vaccination campaigns. Being ready is more important than being quick. And this is the time that the member states in our region must act on being ready to distribute and to vaccinate. From our assessment, most of the countries are not yet ready to roll out vaccines. But they do need to get ready very soon. And so we are urging them to take this time to ensure that everything is in place. We have a checklist of things that are required. First of all, they need a clear understanding of which vaccine will be delivered to them and how to best adapt the cold chains and other logistics that they will need. Then they need to prioritize the vulnerable groups that need to get vaccinated first. Obviously, those groups would also need to know that they are in the priority. They need to know where to access and how to access the vaccine. Then there are many healthcare professionals that will be engaged in carrying out vaccination that also need to be trained and prepared. And we can't stress sufficiently the communication to the population so that people know when and how each group will have access to a vaccine. I know that many of our member states are concerned that they are lagging behind in terms of the 49 other countries across the world, and most of them high-income countries that have started vaccinating. Let us use this time, virtually less than 6 weeks, to ensure that we have everything in place. And not forgetting also that monitoring must be in place, monitoring for adverse events and any unforeseen challenges as well. Thank you.
Muchas gracias, doctor Etienne. Tenemos
Thank
también
you, Dr. Etienne. We have other questions about the vaccines. There is a question from Le Monde, Angeline Montoya, and her question is, what countries are best positioned for vaccination in the region, and how does PAHO interpret that only 5 countries in Latin America have started with their vaccination efforts? Dr. Barbosa, over to you. Thank you very much for your question. Latin American countries and Caribbean countries have a very significant tradition of immunization campaigns. Remember that this was the first region in the world that eliminated rubella, measles, and has made a great deal of progress in vaccination. We are providing technical support to all countries of the region. There is a tool called VERAT. It is a checklist of all the points needed surrounding vaccination. It's not just a matter of having the vaccine available. As the director underlined, is to be prepared, ready, training medical staff, preparation of the cold chain, communication, syringes, everything. So all of these things are being evaluated, and our country offices at regional level are in very close contact with the heads of immunization campaigns so that everyone is ready. We do not believe that any country in our region, we believe that our countries are ready. Those countries who have started already, they had bilateral agreements. They have a very limited amount of vaccine, but it is significant because they are beginning to vaccinate most vulnerable groups, health staff who are in the front lines through COVAX. All Latin American and Caribbean countries are participating in COVAX. Our expectation is that at the beginning of March, our region is going to have 20 million doses. This is the latest estimate from COVAX. And with COVAX, what we want to start is a constant flow of delivery of vaccines so that we can begin with the strategy of priority groups of every country continuously without suspending vaccination for any reason whatsoever. Thank you. Thank you very much, Dr. Barbosa. We have 2 follow-up questions regarding Venezuela. I'm going to read them both. The first one is from Vivian Sequeira from Thomson Reuters. I would like to have comments regarding Venezuela and their entry into the COVAX facility regarding vaccines and syringes. The other question is from Bloomberg. The question is, in mid-December, we heard that there have been some agreements between the government and the opposition in Venezuela to accelerate implementation of the agreement for COVID-19. What is the status of these agreements at this point in time? Do you have the balance of the amount of tests carried out? Has there been any agreement regarding vaccines? Dr. Ugarte, please, over to you. Thank you very much. A very significant couple of questions. I would like to start by saying that in Venezuela, the team of the country office in Venezuela is supporting the health ministry and all the stakeholders in operational and strategic areas for the deployment of vaccine when it arrives. It is a great deal of work, and there is work also, supplementary work from the regional. There are many aspects in planning, including training of personnel, but regarding availability of syringes, in general, syringe just availability for a new vaccine means that 10% more amount of vaccines are needed. So if you have 12 million doses, you would need about 3.2 million syringes. And there are other aspects related to the cold chain. Each different vaccine requires specific cold chains, and you will need refrigeration equipment for transportation to the points of delivery. Venezuela has expressed their interest in joining COVAX, and the National Assembly on January 5th approved a decision to purchase vaccines. However, this is not possible given the lack of resources and timely payments. Negotiations are being carried out so that they could join some kind of facility to purchase vaccines. And we need to add that now more than ever, we need that the parties that signed the agreement, as well as the international community, make better efforts to make sure that the Venezuelan population inside and outside their borders have access to the vaccine. There are negotiations underway, and it's necessary to expedite these processes. There have also been meetings between the parties, the latest one, December 15th, and they talked about testing. As I received a report in recent days where over 3,000 antigen tests have been used, and this is a yield of 1% regarding capacity of the equipment and the tests that have been delivered, most of them in Bayacui and Zulia. In other states, the amounts are lower. And in this sense, a decision was made to review each one of the processes, and in coordination with the National Directorate of Epidemiology, parameters have been established for this review, and we hope that we will soon have specific results to see whether the machines, or if they are placed in the appropriate place, if the mechanism for testing is okay, if the staff is trained, and if the information is being conveyed as it should. We've heard also that in some cases there has been a decrease in the cases that came with symptoms to health services, but this clearly does not explain all cases. Thank you very much. Thank you very much, Dr. Ugarte. Now, shifting gears, and then we will go back to vaccines. But there's a question here about the variants. The first one is Ilana Cornejo from El Diario El Mundo from El Salvador. Last week, you said that the new variant of COVID-19 is circulating in 80 countries in the region of the Americas, but it appears that now it's in more countries. Which are they? And could this be a threat? What other measures can be taken to prevent it from extending throughout? I read this one in English from Tanya Smith from the Tribune, Nassau, Bahamas.
If the new COVID variants have spread to the Caribbean islands. Doctor Aldiguiere, por favor.
Sí, muchas gracias por esas dos preguntas que voy a...
Thank you for your two questions. I'll try to connect them. The first part of the first question, the question from El Salvador in Spanish, there are two more countries in the region who have reported in recent days detection of the variant that has been characterized in the UK. And the variants from South Africa, we have two countries who have reported that variant. So the number of countries that are reporting the variants is increasing. But what I would like to emphasize is the importance of what we have underscored already and what we have heard in the director's comments last week and this week, and it is the importance of strengthening a regional network which involves several countries with different levels of capacity. First, countries which have national capacity to do the virus sequencing and then broaden that national activity, including working with academia, with the universities in those countries. And the second aspect of strengthening this network includes extending to countries which do not have the ability to have sequencing of the virus, so that they have access to supranational laboratories that can help them after they send their samples to these labs. So today we have 14 countries in the region with installed capacity in their countries and we have over 11 countries that have agreements with us through the network in order to increase surveillance. But the most important aspect is to have the detection and then the proportion of variants detected through the lab surveillance system, and then compare it to the epidemiological situation in case of increasing reports.
Regarding the question from the colleague in Jamaica, Jamaica has reported last week variant from first detected and characterized in the United Kingdom. Jamaica, through its national reference laboratories, it's part of the regional network. The network in the Caribbean, in the English speaking Caribbean, is expanding week by week. As of today, we have agreements for this network in the Ministry of Health of the Bahamas, University of the West Indies in Jamaica, the Base dos Santos National Laboratory in Barbados, the Laboratoire National de la Santé Publique in Haiti, regarding French-speaking Caribbean, and also recently with the National Laboratory in the Commonwealth of Dominica. So the same comment regarding the expansion of the laboratory network. This is one of the key aspects of our surveillance and intelligence network in the Americas for COVID-19. Thanks a lot.
Gracias, Dr. Aldiguieri.
Thank you, Dr. Aldiguieri. Now we go back to the topic of vaccines, and here I have a question from Matthias Lobby. What do you think of the strategy to delay the second dose of the vaccine to obtain partial protection with the first dose in most people? Does it make sense? Dr. Barbosa, you have the floor. Thank you. Thank you for the question. All of the vaccines that are being reviewed by COVAX are vaccines that need to be pre-authorized by WHO. When this authorization is granted, the strategic advisory team with WHO present recommendations. The only vaccine, the one by Pfizer, has a clear recommendation. We have no evidence, just to administer one dose. All of the studies conducted on the efficacy of the vaccine that were developed included both doses, but it is possible to delay a little bit the second dose. It could be 2 extra weeks, up to 6 weeks. And this seems to be quite convenient. But just to start with one dose, to reach out to more people without having any idea when the second dose will be received may be a measure that may not have the impact that we need because people will not be protected. Please remember that all of the studies conducted were based on 2 doses, so we only have the certainty of immunization with 2 doses. Thank you, Dr. Barbosa. Now I have a question on Nicaragua. This is from well, I don't know here the name, I don't see the name here of the journalist, but it says that the government of Nicaragua has indicated that PAHO has a plan for the distribution of vaccines, but which is the group that will be a priority? Second question, Nicaragua is one of the two countries that will benefit with the donation of vaccines. What is the number of vaccines that we will receive and how will they be administered on a free of cost basis? Well, I think that I have already answered that question. I can add something to it. We have already mentioned that we have been working on specific plans. Nicaragua is one of the countries that presented their plan. And as to the arrival of the vaccine, the number of doses, and also the timing, these are aspects that are currently being discussed with WHO Executive Council. We have reviewed those elements, and we also have some information that the vaccines could soon be arriving in the countries, but clearly timing this year will depend mostly on the number of countries, and that will also be closely linked to the number of vaccines to be delivered. Jarbas, yes, just to add, Nicaragua is one of 10 countries in the region that, thanks to the existence of the COVAX facility, will have access to vaccines without any need for payment. These are countries that have donor support. That is, these are donors from developed countries, and they have already made contributions to COVAX. In connection with those countries, they will receive, as well as the self-financed countries, the amount equivalent to 20% of their population, 20%, because that is an amount that covers health staff, other social workers from the front lines, the elderly, also individuals that have some sort of conditions such as diabetes, cancer, hypertension, and other vulnerable groups that have not been defined yet in connection with their own country situation. Now, our expectations are to start vaccinating in March on a continuing basis. For all of the countries of the Americas, we are going to have about 20 million doses in March. We're also estimating 35 million in April, 45 in May, 95 in June. So we're going to have sustained distribution on an equitable basis for all of the countries. Once we confirm the deliveries, we are going to know exactly which amount we have for each country. Thank you very much, Dr. Barbosa. I have a follow-up question to a previous question on Venezuela that might not be clear enough. Kevin Arteaga from Carobeño in Venezuela is asking, that is that Venezuela will have no access to vaccines. Is that the answer? Thank you very much for that follow-up. Venezuela right now is not a party to COVAX, and the timeline to join COVAX has come to an end. So I indicated that there are negotiations to have access to other mechanisms through other paths so that Venezuela has access to the vaccines. The revolving fund with PAHO is the mechanism being used for countries by countries that need to have access to vaccines, and that mechanism may be activated, but once again, it will require canceling the debt and also an agreement with the parties to be able to mobilize resources for the acquisition of vaccines. Venezuela is not one of the countries that would be receiving the vaccine free of cost at this point in time. Thank you. Thank you very much, Dr. Ugarte. Now we have a question on Ecuador. This is by Valeria Heredia from El Comercio. Countries such as Ecuador have had direct negotiations with providers. However, we are talking about confidentiality. How feasible is it to maintain this type of negotiation at times when we need greater clarity with information? What is the advice given to Ecuador by PAHO, and what is the level of readiness of this country for vaccination? Dr. Barbosa, thank you for the question. In Ecuador, we are supporting the health ministry to help them develop their vaccination plan with all of the strategy and all of the aspects necessary for a vaccination campaign. We also support the country for the development of the deployment of the vaccine, and also to establish an assessment committee for adverse events, which is key for any new vaccine being used. So we are working with the Ministry of Health of Ecuador to support them in their preparation for the vaccine. Ecuador is part of COVAX, and as we learned, Ecuador and other countries do have bilateral negotiations, so PAHO does not issue any recommendations in that regard. This is a sovereign decision by each country that has to follow their own rules, their own regulations, or as they consider best to obtain access for their country. The director and I met with the Minister of Health of Ecuador, where we addressed the issue of vaccination. We also clarified the COVAX process. We will continue to support Ecuador so that all of the other countries in Latin America and the Caribbean, they are ready for organized vaccination that gives priority to the priority groups with greater communication so that we can administer the vaccines to save lives, and also together with the other measures that work, be able to have the expectation of interrupting transmission in the country. Thank you. Thank you, Dr. Barbosa. We have another question on Ecuador. This is a question related to tests. The question is by Gabriela Quiroz from El Comercio in Quito, Ecuador, and it reads, how do you see the fact that Ecuador only had 42 tests per million inhabitants up to the end of 2020 to diagnose COVID-19? Dr. Aldiguieri. Thank you for that question from Ecuador. First of all, I would like to highlight that the strategy, the methodology for lab tests have to follow the situation in the country, and they are defined based on a surveillance plan. That is the first comment. Next, I do understand that our colleague from Ecuador is referring to national figures, and clearly in Ecuador, and as well as in other large countries, the situation is quite different based on the provinces. So we are referring to a sampling rate that is much more significant in some provinces that are reporting an increase in the number of symptomatic cases. The other aspect that is important is that the strategy and the recommendation by PAHO is to use lab tests for symptomatic patients, that is to say, patients that do have symptoms, rather than to blindly apply a test, a lab test, to a specific number of people. They need to focus on symptomatic patients. The other comment is that Ecuador, and for several weeks now or a month now, has been expanding that network in prioritized networks, areas that have difficulties for access, in areas that have indigenous populations, by using a rapid detection tests based on antigens. And this is the path to enhance community surveillance. I hope I addressed the concerns by our colleague from Ecuador. Thank you very much, Dr. Aldigueri. I also have a question from Mexico. This is by Blanca Valadez. The number of deaths in Mexico has been justified by referring to degenerative and chronic diseases. Is that the truth, or was it something that was randomly stated by the government? Dr. Barbosa. It is well known already that the fact that a person is older than 70, 75, and 80 years of age is an important factor to develop severe forms and die of COVID. And also, individuals at an earlier age with a chronic disease, with hypertension, diabetes, cancer, and others are also of higher risk. This is something that we all know, and when we look at back over the last year that we have been living with this pandemic, the protocols have improved. Individuals are also handling the sick better, the using of oxygen, dexamethasone in people, and there are several means that have been used to make progress in the treatment of the disease, as implemented also by PAHO for all of the countries, for Mexico, with the spread of protocols, virtual training, information for healthcare workers. So certainly when we do see an increase in the transmission, in spite of the fact that most cases are mild, a portion of the population, that is to say, chronic patients and also the elderly, will need hospital beds, ICU beds, and higher monitoring. So there are chronic diseases everywhere. Hypertension, diabetes, they are quite dominant in all of the countries in the region, including Mexico. So that's why it is important to control transmission, and at the same time, the hospitals, healthcare workers, primary healthcare need to be vigilant to identify early those individuals that may have a more severe disease and act early so as to avoid deaths. Thank you very much, Dr. Barbosa. We have another question regarding Mexico. This is by Rene Cruz, who is a journalist with MBS in Mexico. Dr. Etienne indicated that there are 28 countries that have shared their vaccination plans. Is Mexico one of those? How do you assess the vaccination plan in Mexico after a federal judge in Mexico ordered the government to issue a vaccination plan, and he said that their vaccination strategy is quite simplistic? Dr. Barbosa, thank you for that question. I would like to highlight that a vaccination plan, and a vaccination plan that is comprehensive, broad, that covers all of the important aspects, is very significant. To maintain this plan, to guarantee vaccination for everyone, are elements that are very important, also to identify the gaps, strengthen the plan, try to attain new knowledge so that the plan becomes more and more complete, and that is also very important. We have a tool for assessment that all of the countries are using, and that tool checks against more than 100 elements on the vaccination plans, and the countries can automatically identify the gaps, what needs to be improved, or what still needs to be added to their vaccination plans. This tool is very important to identify the priorities that the countries have, and so that PAHO can work jointly with the health authorities in the country to strengthen their plans. So we're working on that with all of the countries in the region, including Mexico. Thank you very much, Dr. Barbosa. Now we are going to give the floor to María Ángel Delgado from Salud Hoy, a YouTube channel. María Ángela, you have the floor. Good morning. We can hear you okay. Good morning. We have quite an alarming situation in Venezuela since there is freedom for all in terms of the treatment being used for the treatment of SARS-CoV-2. So we do not have consensus as to the protocols as the vaccination process is underway. And this has also created speculation and doubts in the sense that many deaths were due to the negligence of the doctors, since they all have the freedom to opine on various medicines. And as we have seen in various means of the press, I would like to know whether PAHO has had any strategy to use just one single voice and force them to follow unique criteria as we continue with the treatment of this pandemic until we attain vaccination, at least in the case of Venezuela. Dr. Aldigueri, I thank Ms. Delgado for her question. This gives us the opportunity to underscore a long time task that the Pan American Health Organization kicked off a year ago. WHO identifies evidence regarding potential treatment for COVID patients. Based on that evidence, PAHO issues recommendations for the management of the patients with the support of panels comprising experts from the region. That includes various profiles, such as experts on intensive care, also heart experts, nephrology experts, etc. After that, the organization communicates that evidence and those recommendations using different means of communications. Systematic recommendations are also available on PAHO's public website. We also share this through the 27 country offices together with the national authorities that are defining the standards of care, and this is also communicated to the professionals in charge and professional organizations such as the ones that I have mentioned. I would like to highlight some aspects. There are specialized guidelines for the management of adult critical patients, guidelines for patients that have recently been diagnosed, characterized, and that live in areas that are difficult to have access to, such as areas of indigenous populations. And there are other public documents. I would like to highlight that it is a challenge that our organization is facing, and that is the infodemic. That is to say, this word, infodemics in English, infodemia in Spanish, that is to say, fake news, including miracle treatments that we see. This is a word that has been in existence for the last 10 or 12 years. And this is not only in connection with doctors, but also the participation of journalists. So my conclusion is that our labor, our work is based on evidence and science. Thank you. Thank you very much, Dr. Aldigueri. It is not clear to me whether Jonas Valente from the Brazilian agency still has the floor. If you do, please, Jonas, go ahead. Otherwise, I am going to read your question. I think he's no longer connected. So Jonas, as well as many others, are asking what countries in the region have already started vaccination in the Americas. Dr. Barbosa. Thank you. Thank you, Jonas. So far, Canada, the US, Mexico, Costa Rica, Argentina, Chile, and Brazil have started using the vaccine. But it is also important to underscore that almost all of the countries have a very limited access to the vaccines. There is no mass vaccination campaign for the population. Out of the countries in the region, the country that has vaccinated the most is the US, and this is proportional to the number of the population. They're reaching 3.7% of their population. So this encompasses health workers and also the elderly who lives in long-term or the elderly care residences. So this limited access to the vaccine situation, as our director has just mentioned in answering the first question, this will take a couple of weeks or even months. So it is very important, and it is good for those countries that have already started with limited amounts. This is also going to be useful to protect the most vulnerable, and it is important to maintain all of the protection measures. It is impossible to think that everyone is going to be vaccinated overnight and that the pandemic has been halted. As we look forward, we need to maintain many of these measures to halt this intense transmission that we see in our region, in Europe, and therefore to halt the number of deaths that we see on a daily basis. Thank you. Thank you, Dr. Barbosa. Now going back to the treatment of individuals who are sick, we have a question, and I will read it in English.
Supporting countries that are facing high occupancy of hospital beds and ICUs to treat COVID-19 patients. La doctora Etienne, por favor. Dr. Etienne. Yes.
Thank you for that question, and my apologies for being a little tardy. So let me say that fortunately for us in this region, we have a presence in almost every country of the region. And we are working hand in hand with all of our health authorities. So we have our finger on the pulse of the pandemic, helping to track progress, helping to identify the emerging issues, and working with the ministries of health to resolve them. So let me give you an example, for instance. In Manaus, Brazil, which is experiencing a dramatic increase of cases, PAHO experts are embedded with the Ministry of Health teams. We are working and providing advice in emergency and ICU clinical care in real time. We are also giving support to infection prevention and the reduction of transmission, surveillance, and accessing supplies as required. Very importantly, we are also actively reviewing the evidence and updating clinical management guidelines to make sure that the countries have ready what is the best scientific information available to treat patients. We have an important role to play in tracking new infections, in monitoring hospital bed occupancy. And when we see that transmission rates present a risk for the health system's capacity, a risk for even the transmission of the disease, we flag this. And we do that both in direct communications and conversations with the ministries of health, but also in our public communications. So we are working very, very closely with ministries of health, both at a national level, at a regional and state level, to help them in managing outbreaks, to help them in forecasting and particularly forecasting hospital bed requirements, and in working to reduce transmission, particularly as community transmission goes totally out of control, and we see those massive increases in the number of cases. So be assured that PAHO will continue to work with our member states to ensure that we can mount a response with our member states to this pandemic. And we have every hope and that with the acquisition of vaccines and the continuing and sustaining the vaccination programs, that we should be able successfully to slow down initially and then to stop the pandemic. Thank you.
Muchas gracias, doctor Etienne. Gracias a
Thank you
todos.
very much, Dr. Etienne. Thank you all for your participation with this response. We get to the end of our press briefing. If we were unable to answer all of the questions, we can do this on follow-up, and you can write to us and ask additional questions at mediteam at PAHO, and you can also obtain more information on our website. We will go back to Wednesday next week, to our usual day. Until then, have a good week and a good weekend. See you later.